Now we're going to talk about the nephritic syndromes. The first nephritic syndrome that we're going to talk about is mesangial proliferative. Mesangial proliferative. This is either an IgA or IgM mediated process. Okay? So what happens is that you have IgA or IgM deposited in the mesangial cells, like we talked about earlier with the focal segmental glomerulonephritis. Okay, this is going to cause damage to the podocytes. It's going to cause a proteinuria. What's important to understand here is that there's a difference between the IgM and the IgA. IgM is a nephrotic process. It's associated with systemic lupus erythematosus and other connective tissue diseases. It's going to have nephrotic syndrome and hematuria. It's going to be less devastating. What's more devastating is something that's mediated by IgA. And if this is mediated by IgA, this is important to know for step one, is that this is called Buerger's syndrome. Okay? In your urinalysis, you're going to have dysmorphic red blood cells, and you're going to have red blood cell CAS. Buerger syndrome, IgA, connective tissue diseases, IgM. This is can also be seen in post-streptococcal glomerular nephritis. The next nephritic glomerulopathy that we're going to talk about is diffuse proliferative glomerular nephropathy. Diffuse proliferative is immune complexes deposited in the subendothelial layer. Subendothelium. Remember we talked about how dangerous it was to have immune complexes in the subendothelial? This is a very, very dangerous disease. So this has an aggressive course of declining kidney function. Okay, when you have immune complexes in the subendothelium, you have destruction of the subendothelium, and all hell breaks loose pretty much. Causes of this can be tumor infections, hepatitis, endocarditis, cryoglobulinemia, post-streptococcal glomerular nephritis. This is a really, really bad problem. And this can progress into something that we call rapidly progressive crescent glomerular nephritis. And this causes renal failure over days to weeks. So this is very, very dangerous for patients. Very dangerous for patients. One more nephritic syndrome that we're going to talk about that I didn't talk about earlier is Alport Syndrome. Alport Syndrome is a problem with deposition of type 4 collagen. Okay? This is really important. This is in first aid. This is something you're going to need to know for step one, is that when you have destruction of type 4 collagen in the glomerular basement membrane, you're going to have destruction of that glomerular basement membrane. You're going to be bleeding out through your kidneys. Okay? You can also see this in Goodpasture syndrome. Remember, this is a type 2 hypersensitivity reaction with antibodies to the glomerular basement membrane. Okay, you can see this in Wegener's granulomatosis. Remember that Wegener's granulomatosis is C-onca positive, and you can have microscopic polyangiitis, which is P-onca positive. So you can see these nephritic syndromes with the microvasculopathies. Okay, Goodpasture syndrome, Wegener's granulomatosis, microscopic polyangiitis. Okay, in Alport syndrome, we have a mutation in type 4 collagen. This is a genetic disease. I talked about it just a second ago. Alport syndrome is a mutation in type 4 collagen. So you're going to have a split basement membrane, and you're going to be bleeding out of your kidneys. Okay, so this wraps up our discussion of the glomerular diseases, the glomerulopathies. I hope that this was helpful and educational. This is just the tip of the iceberg when we're studying the diseases of the kidney, but a lot of the diseases in the kidney are associated with glomerulopathies. Okay, they progress to some type of glomerular disease. You have declining kidney function, and you have declining glomerular filtration rate. Okay, and now you have some sort of kidney disease.